Hello, I'm Heather McNair, Chief Nurse here at York Hospital, and I have responsibility for the patient experience, and that includes the National Cancer Patient Experience Survey. And we know most of our patients' experience is really good, but we know there's always room for improvement. I'll let the team tell you about how that's going to work going forward.
We're aiming to improve the number of patients who have access to a care plan. The last National Cancer Patient Experience Survey that was published, we as a trust were pretty much average, in line with other trusts. However, we didn't think that was sufficient because that's a low figure and we wanted to improve on that, particularly with haematology patients who are a little bit less than the trust's average. So we wanted to significantly improve that figure, because by doing that, we're improving patient care.
Regarding equality and diversity, prior to the project, the cancer nurse specialist would consider who would benefit most from completing an electronic health holistic needs assessment. Through the project, we're now offering all patients who are diagnosed with a haematological cancer the opportunity to complete an EHA and develop a care plan to suit their needs. The EHA is available in many languages, in many different formats to suit patients from all abilities. As a project team, we're working with smart objectives to make sure that the aims of the project are achieved within the timeframes we've been given.
Initially, we started with a process mapping session where we had the key stakeholders in the room to map the current process of how a holistic needs assessment is offered to patients. Completing this, we established key areas for improvement, which we detailed in our project plan. The haematology team have now formalised the process by creating a clinic where they offer all newly diagnosed cancer patients an EHA, an electronic holistic needs assessment, and develop a care plan. This has now increased the demand of the team. Following the introduction of the telephone clinic, we've been capturing the number of patients who have accessed that telephone clinic on a weekly basis. So prior to this project, many of the patients were unavailable at the times that the cancer nurse specialist requested a telephone appointment. Therefore, the coordinator now rings 2 days before their appointment to remind the patient that to attend their appointment. This has increased the number of people that access the clinic on a weekly basis, therefore reducing delays. This has increased the number of care plans that are completed within the haematology team. As part of the project, we've been collecting quantitative and qualitative data to ensure that we measure the impact of the changes that we are making. Every patient that receives a care plan also receives a patient questionnaire asking them about their experience of having a holistic needs assessment. With the patient feedback, we work with the haematology team closely to look at how we can keep continuing to improve their experience of the patient. The care plan is shared with the GP, and the GP is then sent a questionnaire to ask them if, following the care plan, did that result any further actions for them to contact the patient or complete a cancer care review.
In addition to using the PDSA cycle, we've used adopted, adapted and abandoned improvement tool. We've adopted the use of the Macmillan Electronic Holistic Needs Assessment tool. We've adapted in terms of using different personnel to conduct the electronic holistic needs assessment and to develop the care plan. And we've abandoned the use of paper versions of the tool. We've also abandoned selecting patients to have a holistic needs assessment. We now offer it to all patients.
9 years ago, I was diagnosed with prostate cancer. I had various treatments in York and Leeds. I had high-dose brachytherapy and radiotherapy, hormone therapy. I've been involved in the Cancer Collaborative since its inception in 2019, but before that I was involved in the recovery package, which as a patient has been hugely interesting. I've been able to see all the hard work that's being done to improve patient care. I felt it was important to experience what a needs assessment was and what one had to go through in order to get one. And so I did have a needs assessment done, which I found very interesting. I can see for patients who really do need that support and care, a holistic needs assessment is the way forward. After I had my holistic needs assessment completed, the care plan was drawn up and shared with my GP and obviously kept on file. And therefore there is a record of my needs.
Attending the network days gave us the opportunity to meet our peers and share best practice. Knowing that the group was coming together at 30, 60 and 90 days really helped keep us on track and maintain our focus. Some of the improvement tools shared at the events helped us to develop our project further. We've learnt a lot through all of this activity, and so we'll now share some of our key learning points with you. Firstly, embedded practices are really hard to change, so celebrate all successes and think small.
Identifying the key stakeholders is really important at the beginning of the project to establish who's going to be involved and make sure that you have the right skill sets in the room to make sure the project moves forward.
Through doing a patient focus group, we learned that patients don't necessarily need or want to have a holistic needs assessment conducted by a healthcare professional. They need someone with good listening skills and someone who can signpost them in the right direction.
Utilising various skill mixes within the haematology team, we have been able to streamline the process of completing an EHNA and a care plan.
In conclusion, the haematology team are now set up in a sustainable way, and we're sharing that learning with our other cancer teams, and they in turn have developed their own delivery plans for this project.
We've also learned that there's a big difference between a nurse-led and a patient-led discussion. Therefore, we're changing our conversations from what is the matter with you to what matters to you.
And finally, just a word of thanks to the project team as a whole, particularly to the haematology team for their support, and also to the collaborative. Thank you.